There he is.
Hi.
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 How are you, Dr. Belfer?
Good to be here this afternoon.
Wonderful. Well, it's great to have you here. It's actually the morning for us here in Reno, Nevada. But I am so excited to bring you all, as I was saying, Dr. Myron Belfer. He is a true pioneer in global mental health. Dr. Belfer is a professor of psychiatry in the Department of Psychiatry at Children's Hospital in Boston. He's also at Harvard Medical School, and he's a senior associate in psychiatry at the Children's Hospital of Boston. He is a child and adolescent psychiatrist and is also on the affiliated faculty of the Harvard Center for the Developing Child. Dr. Belfer is also former senior advisor at the World Health Organization for several years. For me personally, he's a mentor and he's been instrumental in our work around the world on hope. He's really helped refine hopeful minds and has been a key mentor and leader for me in this space. So I'm so excited to have him here. Thank you so much for joining us, Dr. Belfer. How are you?
I'm very well. Thank you, Catherine, for that introduction. I'm here today to talk with you about the global impact of COVID on mental health. I would argue that COVID is unprecedented in our lifetime. Perhaps the pandemic of 1918 or the genocide that we've experienced in many parts of the world over the past decades have affected same numbers of people in terrible ways. But the impact of COVID is unique in many ways. It's unique because it's been sustained over time. When we think of 9/11, when we think of a tsunami or earthquake, they're usually time limited, and people have an idea of when the end will come. With COVID, it's been indeterminate so far. In other words, we hope that it's coming to an end, but we really don't know. Also, there's the question of the unknown. In other words, often we know who the enemy is. In other words, in a way, it makes it easier for us. But here, the virus can't be seen by the ordinary individual. And so that makes it strange, particularly with younger people, in other words, who have a hard time conceptualizing foreign objects. Also, in other words, we feel helpless. In other words, the people we've turned to in the past as experts have not seemed to have the answers that we want. And even in the best medical facilities in the wealthiest countries, the mortality rate was extraordinary. Likewise, in other words, in countries that didn't have the resources and in groups, marginalized groups in any country, they've been impacted in greater numbers. In other words, so that people who previously did not have access to health care suffer the most, in other words, and are marginalized in their ability to be able to get back into the mainstream. This is going to be a long-term problem. We had a number of mental health studies. The interest in mental health in the world is unprecedented at this time. It's largely because we've seen a spike in suicides among people who we didn't expect would be vulnerable. So healthcare workers, frontline responders, people we thought of as being very strong and being able to tolerate all sorts of adverse experiences, have killed themselves. They've been unable to handle the stresses associated with COVID. The same is true in families. We see an uptick in abuse, in other words, conflict at home, inability for children to be able to access colleagues or friends, in other words, to be able to associate with others in normal ways. And this will have consequences later for their socialization. Children have been out of school now as a result of COVID and the pandemic. The impact of this being out of school is yet to be determined. Will children be able to catch up educationally? That's important. But more important, what will it do to social relationships? What will it do to trusting institutions that are charged with the protection and the support of individuals? I think that we have a lot to learn from COVID about mental health, about the building of healthcare systems that will be more responsive. Healthcare systems were totally unprepared for this pandemic. And we must not forget the lessons that we've learned during the pandemic for the development of healthcare systems that will be responsive. I hope, in other words, that mental health, in other words, will be included, in other words, in the development of these newer, more responsive systems for healthcare. We have to be able to get back to a society, in other words, that will embody mutual respect, trust, and the ability to have a future outlook, a future perspective on things. We need to build hope, in other words, for the future. And this is a daunting task. In other words, we, as a result of COVID, we have so many people who've lost their jobs, lost their livelihood, lost their self-respect, have been unable, in other words, to feel as functional as they were in the past. How do we heal this? It's a major challenge. It's not simply in the medical field. It's in the field of related to all of us: education, social support. Every aspect of society needs to come together to be able to support individuals. We cannot deny, in other words, the impact of COVID. In other words, to think once COVID has ameliorated that all is over would be a major mistake, because I think the consequences of COVID will be with us mentally, in other words, for a long period of time. Can we rebuild trust? Can we feel confident in authorities? Can we feel confident in the healthcare system that it will have the resources to help us? As a psychiatrist, in other words, my concern certainly is not only with the people who've been impacted by suicide, which is a terrible loss and tragedy for so many families, but the overall morbidity and mortality that's been associated with COVID has touched so many people throughout the world. It's almost rare now to not know someone who's been impacted by COVID, either surviving the illness itself, in other words, or being able to mourn. When we speak about mourning, one of the other consequences of COVID, in other words, during the height of the pandemic, has been the absence of the ability to adequately mourn individuals who've been lost. So we haven't been able to have church services. We haven't been able to have services that would help to heal the loss of an individual. I know personally for some families that this has been a lingering trauma. The inability to be able to access religious authorities in person, the inability to go to the cemetery, the inability to simply grieve in a way that allows one to heal. So this is not only in the area of mental health, in other words, but it's in the area of society being able to support individuals to be able to look more towards the future with hope, with hopefulness, with the ability to feel good about themselves and about the society that they live in. I'm hoping, in other words, that as we move forward, we'll be able to think about ways to particularly support children. I think we have a lot to learn in relation to the mental health of children. Young children will have experienced the grief of their parents. In other words, the isolation that's unprecedented, the absence of solutions to problems that they have looked forward to. I worry, in other words, that we're not talking about simple anxiety disorders or ADHD or other kinds of more formal disorders, but we're talking about a disruption of normal development in these children. And what will the consequences be? We know from research that children at various stages have a limited capacity to kind of catch up. In other words, and what will we do? What kinds of interventions can we develop to help children catch up, to get back into the mainstream, to regain a healthy trajectory in their own lives? So those are some of my thoughts about the global impact of COVID. Catherine had asked me if I had some examples of really great programs that help people. Well, there are individual programs. In other words, in China, in the U.S. and elsewhere, that have aimed to help healthcare workers by connecting them through electronic resources with their families, through Zoom. Everybody knows about Zoom these days, ways in which people have fostered connections. However, these examples are limited. And unfortunately, the people who are able to access a lot of these interventions are people who are better off to begin with. They have the economic and social wherewithal to be able to take advantage of these programs. So I think we're challenged to really find good programs that are easily accessible and don't require resources that may be very hard for individuals to gain. On this side, in other words, I think that we in fact have learned a lot. In other words, the use of Zoom, the use of distance learning, the various experiments in education may all hopefully give us some insight into what we can do better in the future in a number of different domains. Most importantly, I think we all have to have hope that the future is going to be better, and that we will have learned from this experience. Thank you very much. I'd be happy to take some questions from Catherine or comments.
Wonderful. I mean, yeah, you gave such a great overview in terms of how cross-cutting the impact of COVID is in so many ways that I didn't even think about. And like you say, the grief and the separation and experiencing loss and not being able to connect or have services or be with loved ones. I mean, that in and of itself is pretty massive and so much part of the healing journey and experience. So really great points. And I think as we look at creating a happier world and healthier world and heal from this moving forward, we really have to think in such a broad way. You've been involved in mental health for so long. Do you think, and I think, 20 years ago, we wouldn't have even been having the conversation necessarily of mental health in this, at least in a limited capacity. Do you think that it's changed? Do you think that now we're talking, do you think this will aid in us all talking about mental health and physical health and how it's connected?
I hope so. I think one of the reasons I'm hopeful in that regard is that the mental health issues have so impacted the healthcare community. In other words, that it's very difficult for healthcare providers to ignore their personal psychological experience, their personal mental health problems during this period of time. So I think that may translate into the development of programs that will be sustained in the healthcare sector that will include mental health. And the same is true, I think, in the education sector, which in many ways has been devastated by COVID. In other words, totally unpredictable experiences. And going back into the classroom for teachers, they're going to have as many worries about mental health concerns as they will about the curriculum in their education. In other words, and for families that previously may have been able to ignore mental health, the experience of isolation, the experience of confinement, the precipitous loss of jobs, income, and other kinds of security will certainly shake a lot of people to think much more about their mental health and how to preserve it in the future.
Yeah, absolutely. And we know with the work on hope that it's our ability to kind of re-navigate or set a new goal or new vision or something that really predicts how hopeful we stay throughout these kind of major life events and major challenges. I was speaking and doing some interviews with kids or teens, and they talk about how low in hope they are. Just that the kids they work with have no hope. And yet the one thing I felt really positive about is they said, and I said to them, well, do you know, how do you define hope and how do you define hopelessness? Because they know hopelessness is very strong as well, and they identify with hopelessness, and yet they don't really know how to define it. And I said, well, once you define it, what if we can teach you it and teach it to you? And they found this really exciting, that they can start to understand what hopelessness even is, and that they can start learning how to get out of that hopelessness to hope. So it was really promising from a youth perspective in terms of potential to even just help starting to get them these tools, how to manage their stress proactively. But it's been such a hard time on that age group for sure, and I've seen that as well.
Well, I think it's been difficult, Catherine, across all age groups. I think from the elderly down to the very young. I think there's no age group actually that has escaped the impact of COVID. In other words, which again makes it unique. In other words, often the traumas that have been experienced have been focused on one group or another, and some group has been spared. But with the COVID pandemic, no one has been spared. In other words,
that's true. What did you learn? So when you worked with Dr. Joseph Murray, and he was a Nobel Prize winning physician. He did the first human transplant, and he dealt with a lot of people in very challenging situations. Can you share a little bit about how he practiced through the use of hope, no matter kind of what people were experiencing?
Sure. Catherine's referring to Dr. Joseph Murray, who won the Nobel Prize for kidney transplantation. But actually, he did a lot of work with head and neck cancer, and the people had a very, very bad prognosis. Okay, but he never ended up talking to individuals about their prognosis. He really, the news he would have had to deliver would have been bad news. So he always talked to the people about what was the next procedure. What can we do next? And in essence, what he was doing was giving people hope that there was a next procedure, whether he believed it or not. I think he did believe it. In other words, but this was his way. He was not a psychiatrist, but he was intuitively, psychologically very attuned to what individuals facing terrible situations need to deal with.
So what would you suggest that we kind of look to next as a next step, as a world moving forward post-COVID?
I think that there's a real challenge to leadership. In other words, to offer hope. In other words, in concrete ways. So the same way you have a hope curriculum, I would hope that leaders would develop a more global governmental hope curriculum. I'm serious. One that offered the kinds of concrete support that people could count on, that people could rebuild trust in institutions and in leadership. In other words, and in science. In other words, so there's a lot of work to be done by leaders, not simply in the mental health community. In other words, the mental health community can help by picking up the pieces and trying to do what it can to provide some input into some of these initiatives. But everybody is going to have to be involved and engaged in building good mental health.
Wonderful. Well, thank you so much for joining us today. I think we're off to our next speaker, but so helpful and a really great global perspective on what's happening and the impact and what we can do moving forward. So wonderful to have you. Thank you so much.
Well, thank you, Catherine. Thank you for the World Happiness Fest.
Absolutely. Have a wonderful day.
Thank you. Bye-bye.
Bye.